Good morning everybody. Today we are going to discuss about the second part of the breastfeeding and its all the advantages and some of the difficulties one encounters during the period of lactation and breastfeeding. So, last time we have seen what are the various advantages of breastfeeding. Today we will see some of the difficulties which we come across. We all know that nutrition is very important aspect of life, and if it is not being properly taken care of, then there is a high amount of percentage of malnutrition, and that can be responsible for the almost as good as 45% of the deaths in children below 5 years of age. And so, to avoid this, we have to look for various aspects of the nutrition, and most important of all is the breastfeeding or the lactation. Now, coming to the why there is a failure of lactation. Majority of the mothers, they succeed in successful lactation of the lactation and the breastfeeding, but some of them they fail, and what are the various factors responsible for them, that we will see. The most important factors, they are the related to the breastfeeding practices. What practice is being used during the onset and the continuation of the breastfeeding, that is equally important. And one of the factor is a delayed start. Most of the times what happens, traditionally the older people, they consider that the first part of the lactation, that is colostrum, is yellow in color, and therefore it is foul, it is not good to give the feed. That is the misconception in the minds of the elderlies, and therefore they do not allow the lactating mothers to feed their colostrum to the baby, and that gives rise to delay in the start, and that leads to variety of the problems, including that the baby remains hungry, baby do not get optimum nutrition, and there is a engorgement of the breast becomes painful, and mother then has got a lot of difficulty in initiation and maintenance of the lactation. Second important factor is the infrequent feeds. Initially the milk comes in drops, and therefore every time mother feeds the baby, there is a cumulative increase in the amount of the milk which is being secreted, and therefore more frequently the feed is given, more the amount of milk being secreted, and therefore frequent feeds in the first 5 days is equally important. As early as every hourly or every 2 hourly in the first 5 days is equally important to have a good start of the lactation. Then third important reason is that no night feeds. What happens during the night hours, the lactation is at its peak because of the various hormones, particularly the prolactin being secreted in large amount during the night hours, and therefore night feeds has to be given because that will improve the amount of milk secreted as well as the baby getting the milk. Dislike for breastfeed. Sometimes the mothers, particularly the modernized mothers, they feel that we should not give the feed to the baby, that is as good as animal behavior, and therefore they try to be assumed or go away from the practice of feeds, and this gives a very bad concept. They have got something conceived in their mind that breastfeeding will disturb their figure, their appearance will be lost, and therefore they have got a misbelief that breastfeeding should not be given. So that type of phenomena, when it is there in the minds of the mother, then that gives rise to failure of lactation. Then short feeds. The feeds has to be sufficiently enough to empty the breast. If it is not being emptied completely, the foremilk and the hind milk, these are the two components of the milk in each feeding session, and therefore it is to be followed that both the foremilk as well as the hind milk has to be given to the baby, so that baby feels satiated and has got a milk which has got a high amount of fat and therefore the calories. So short feed should not be given, it should be sufficient enough, say at least for a period of 5 to 10 minutes initially, and then at the most for 10 to 15 minutes. Then bottles and pacifiers, they interfere with the phenomena of lactation. That gives rise to a phenomena what is called as a say that initially the baby had a suppose bottle or pacifier being given, she feels that that was better to suck. Now why the mother's nipple is being given, and that gives rise to confusion in the baby's mind, and therefore she tries to avoid the breastfeeding, and therefore that should not be given. Complementary feedings or pre-lactal feeds, that should not be given, because that interferes with the frequency and amount of breastfeeding to be given to the baby, and therefore complementary feeds should be avoided. Similarly, there are certain physiological factors in the mother which also leads to failure of lactation. These are, first and the foremost is lack of confidence. Mother feels that she will not be enough in a position to feed the baby, and baby remain hungry, and therefore that lack of confidence gives rise to a failure of synthesis of the hormones and secretion of the hormones, and therefore the lactation gets interfered. Same thing is about the worries, stress. These are the lack of confidence, worries and stress. They are all psychosomatic factors or psychological factors in the mother's mind which interferes with the lactation. Same thing is the another phenomena what is called as poor attachment to the breast. Now, as we have seen in the previous session, that the baby has to be applied over the breast enough that amount of complete areola should be inside the oral cavity of the baby, and she should be able to strip the milk from the nipple with a stripping action, and therefore if there is no proper attachment, the baby will not be able to suck the milk adequately, and therefore that will lead to a variety of problems that we will be seeing later on. Same thing is smoking interferes with the lactation. Rejection of the baby, mother feels that this baby was an unwanted baby, and therefore I don't want to feed this baby. That phenomena also gives rise to a failure of lactation. Then tiredness, mother feels that she is extremely tired. On the contrary, the giving artificial feeds gives rise to more of tiredness, preparation, cooling, then feeding, sterilizing the bottles or sterilizing the utensils, all that gives rise to more of tiredness. Rather, breastfeeding gives rise to less of any energy utilization from the mother, and therefore that should not be the concept in the mother's mind that tiredness will be there following lactation or feeding the baby, and so she should be promoted for the breastfeeding. Now, this is one example of poor attachment due to retracted nipple. What happens during pregnancy, the latter part of the pregnancy, third trimester, if there is no proper examination of the breast being done by the obstetricians or the caretaker, then what will happen? The certain anomalies in the nipple and the areola will remain as it is, and then that will interfere with the lactation. And one of that is nothing but a retracted nipple. If the mother presses on the fore part of the or the anterior part of the say areola, what happens? The nipple goes inside, and same way the baby when applies the oral cavity or the mouth over the nipple and the areola, the nipple doesn't come into the oral cavity, and therefore that leads to a poor attachment and baby has got difficulty in sucking. So that is one important reason. How to negotiate this problem is that the either manually one can mother can take out the nipple anteriorly or pull it out just before the onset of feeding the baby, so that the retracted nipple over a period of time is taken care of. The another method is what is called as a artificial method, what is called as a Kesari method. Dr. Kesari from South India has developed a simple technique where the syringe, say at least a 5 ml or a 10 ml syringe is to be taken, a fresh aseptically prepared syringe or a plastic syringe, disposable syringe, where from the nozzle part of the syringe, the anterior part is cut out with the help of a blade, and then what happens, the piston is taken out and piston is inserted from the cut end like this, and then subsequently the flat portion of the syringe is applied over the nipple area or the areola area, and gradually mother herself pulls the piston out, so that by negative or vacuum pressure the nipple comes out. This is what is being demonstrated in the side of this particular slide. What you find that the caretaker applies the gentle pressure over the nipple, and she pulls the piston outside so that the nipple comes out, and then subsequently baby can be fed. You see that this breast is also engorged, and simply because the mother was not able to feed because of the retracted nipple, and therefore this can be negotiated, this can be taken care of by the help of this method, what is called as Kesari method or a syringe method. This is another example where there is a failure of lactation because of the engorgement of the breast. The milk, when it gets retained in the breast tissue, the breast gets engorged, and therefore both the breast becomes painful. And in that case, the baby, even the nipple also gets flattened out, and therefore what happens? The baby is not able to latch on or apply the oral cavity or the breast tissue properly, and that leads to a difficulty. And so whenever there is an engorgement, one should try to avoid this engorgement of the breast by gentle say manual expression of the milk. But if it is not being done, then what happens? One should give first of all a hot fomentation or warm fomentation of the breast, then gentle manual pressure or massage of the breast so that the milk comes out anteriorly, and then pressing over the areola area where the lacteals or the sinuses are present, so that milk comes out. This manual expression of the milk, or with the help of a breast pump, one can take care of this engorged breast, and then baby can suck the milk properly. This is another condition where because of the improper say latching, or the baby is not able to suck properly. In that case, what happens? The nipple area gets eroded because the baby applies lot of pressure by the gums over this nipple area, and that leads to a condition called as cracked nipple or a fissured nipple. This is a very painful condition, and whenever there is a pain, what happens? The mother's hormone synthesis and secretion gets hampered, and therefore the lactation gets difficult, or lactation is diminished. So therefore one has to see that this particular phenomena should not occur. Now how to tackle this issue? In that case, first of all, the mother should be asked to apply the baby properly, so that latching phenomena should be proper. And what is normal or proper latching phenomena? The portion of the areola itself, this portion should be inside the oral cavity of the baby, so that she does not apply gums over here, and she can press over here so that the baby can suck the milk properly. That is number one. Number two, whenever there is a say wet erosion, mother herself can apply the hind milk over here and expose the breast tissue to the atmosphere, to the sunlight, so that it gets healed very easily or quite early. Then this is another condition where you have got the problems in the breast tissue, the melanofibromatic growth. This also interferes, but what happens if this interferes with the sucking and swallowing phenomena? Then in that case, expression of the milk manually and feeding the baby can be done. The nipple confusion, what I said, when the baby is given the top feed, either by katori spoon or pre-lactal feed or by a bottle, in that case the baby gets adapted to that type of phenomena of sucking and swallowing and feeding the. But when the mother applies the breast tissue, then she feels that this is something different, and I don't want to exert more while sucking the milk from the breast tissue, and therefore this nipple confusion creates a phenomena, and therefore baby doesn't want to apply the oral cavity or the mouth over the nipple, and this is called as nipple confusion, and she actually pulls out the oral cavity or the mouth from the nipple and pushes the mother away from her mouth. So this type of phenomena, what you get, is called as nipple confusion, and this is consequent to the improper practice of giving either pre-lactal feeds or the artificial feeds. Now what are the neonatal conditions which interferes with the lactation and gives rise to a difficulty and therefore failure of lactation? First and the foremost is the prematurity. Premature babies, they need mother's milk. That is being highlighted each and every time, and it is quite important to understand that the mother's milk has so many important biological nutrients which are very much helpful for the growth and say caloric needs of the baby, and therefore if the premature baby is not able to suck adequately, suppose baby is below 1 kg, she is not able to suck properly, in that case the mother's milk has to be expressed, and what is called as express breast milk has to be given to the baby with either a katori spoon or with the help of a tube feeding or gavage feeding. Then if mother is by some reason or the other is not available, own mother's milk is not available, in that case the milk from the human milk bank has to be taken, and that has to be given to the premature baby, because all the nutrients available in the breast milk, they are of great importance for the growth of the baby and for the life of the baby. Then tube feeding can be given accordingly if baby is not able to swallow properly. Then second is a malformed baby, babies who has got different types of malformations. Say for example cleft lip, cleft palate, in that case the feeding has to be given by different mechanism that we will discuss just now. Then babies having congenital heart disease and congestive cardiac failure. We know that these are the conditions where salt requirement is low, and as we know that breast milk contains less amount of salt, less amount of say electrolytes, and therefore it does not lead to congestive cardiac failure. On the contrary, it is helpful for a patient who has got a cardiac disease or a congestive cardiac failure. So that is very important thing. Then babies having say renal failure, against renal solute load in a breast milk is less than in a top feed, and therefore breast milk is a milk of choice in babies who has got such conditions, and therefore breastfeeding has to be optimized for patients or babies, newborns or otherwise who has got a renal failure. Same thing is about the respiratory distress syndrome, then sepsis babies, NEC babies, all these are conditions where the breast milk is a milk of choice, is a food of choice in all these conditions, and therefore that has to be optimized either by express breast milk or by direct breastfeeding or by katori spoon feeding or by tube feeding or by whatever means it is possible. One should always optimize the breastfeeding for these babies so that their growth and life can be very well maintained. Now feeding, coming to the first part, that is feeding the preterm and low birth weight babies. Now breast milk, the best milk, this everybody knows, and you know that there are certain biological nutrients present in the colostrum and the various other types of milk which are of great importance to the preterm baby. Now the breast milk, we have got various components. One is colostrum, initial 4 to 5 days. Then you have got a transitional milk where the milk becomes slightly different in consistency and protein and the calorie output. Then you have got a mature milk by the time the baby is 10 to 20 days old. And then another type of milk, what is called as a preterm breast milk. Preterm breast milk is the milk where the mother has delivered prematurely, and the milk coming out of the mother who has delivered prematurely, that becomes a preterm breast milk. Now what is the difference? Difference is that this particular milk has got higher amount of proteins, higher amount of immunoglobulins and higher amount of fat content as compared to present in the mature milk, and therefore this is of great importance, though the volume is less, but it is of great importance for the growth of the preterm baby. Then pasteurized donor breast milk, what is called as PDBM. So this is another milk where that we will discuss very soon. The milk is taken from the breast milk bank and is being given to the premature baby. So that is what, these are the various mechanisms or ways we feed the baby who are born premature or who are having a low birth weight. Now the techniques that I already discussed, the direct breastfeeding, KSF means katori spoon feeding, then gavage feeding, that means tube feeding, transpyloric feeding when there are babies who are operated and it is not possible to feed the baby, either say for example patients who has got the tracheoesophageal fistula being operated, you have got a tube inside, and in that case you can feed the baby, and to prevent the regurgitation, in that case we can give milk through a tube, what is called as a transpyloric feeding, and jejunal feeding similarly in operated patients who do not tolerate the gastric feed. Now coming to the in great detail about nutrition in preterm and low birth weight babies. What is its importance? We find that the preterm nutrition is given to achieve postnatal growth that should be appropriate or approximating the growth in the fetal life. So, normal fetus at the same rate the baby should have a growth, and that is the main aim of giving the baby nutrition, which is slightly different than direct breastfeeding. Now, coming to the limitations. What are the limitations in the preterm and low birth weight babies? First and the foremost, because they are born premature, they do not have calorie reserve in the form of fat or glycogen store in the liver and muscles. They are all less, and therefore the nutrient store or reservoir is less in these babies, and therefore their growth is very much affected. Calorie output is much affected, and therefore they can go for early hypoglycemia and its complications. Second thing is anatomical and physiological immaturity of the kidney, of the even the swallowing mechanism. The kidney, respiratory system, cardiovascular system and central nervous system all are important, and therefore the nutrition should be so designed that it does not interfere or does not lead to any complications in these systems. Then third is the metabolic instability and immaturity. Just now I said they can have hypoglycemia, they can have hyperbilirubinemia, they can have the metabolic acidosis. So, these are the certain metabolic complications which the premature baby develops very fast and very frequently, and therefore, the breast milk is the best solution for these babies. Then rapid growth. Growth is rapid because that is the fetal growth during the last trimester is very fast as far as the weight and even the length is concerned, and therefore, their nutrient requirement is very high, but the capacity to swallow, capacity to digest, capacity to assimilate, all these are limited, and therefore, this particular challenge is there during this period. Then susceptibility to various congenital and acquired illnesses. The infections are there during this period, and that also gives rise to what is called as a catabolic condition. So, hypercatabolism also increases the caloric needs of the and the protein needs of the baby, and then susceptibility to immediate disaster and long lasting sequelae. So, these babies they ultimately suffer from the early as well as the long lasting in the form of neurodevelopmental outcomes and early problems like say necrotizing enterocolon. So, these are certain limitations and challenges in the preterm babies as far as the feeding is concerned. Now, let us see some of the anatomical faults present in these babies. We find that these babies are the one who has got the congenital malformation in the form of cleft lip, cleft palate, and how to negotiate this. What happens when there is no good vacuum being created, baby's sucking capacity becomes exhausted, and therefore, they are not able to suck the adequate milk and breast engorgement can occur. So, to negotiate this issue, simple thing is that to give more amount of breast tissue inside the oral cavity, so that breast tissue itself acts as a shelf at the cleft level, and that can help in creating a negative or a vacuum pressure, so that the milk can be sucked very well. If that is not possible, then one can use the various dental appliances, so that the dental appliances can seal the gap and can help these babies. So, that is the method of treating these babies with cleft palate and cleft lip. Now, coming to the patients who has got protein calorie malnutrition, as we all know that this particular entity is a end result of failure of lactation. So, from prevention point of view, what is important is that the lactation should not be lost. There should not be failure of lactation. On the contrary, one should try to optimize the lactation, and the exclusive breastfeeding, extended period of breastfeeding up to as much as 2 years of age, and to prevent the PEM, this is very important to give the breastfeeding. And you know that even in these malnourished people, malnourished children, the best option is breastfeeding, because it is easy to digest, it is adequate in calories, it is adequate in all the factors or nutrients which are responsible for improving the immune capacity of the baby. As we know that PM babies, they are immune capacity wise, they are having a restriction, and therefore they are susceptible to various infections, and therefore the best option for all these problems is breastfeeding. So that should be optimized as early as possible, and these are the situations where you get, first and foremost, you get babies who are born premature and they are being not properly being given. Then when there is a maternal loss, that means mother has died, or there is a stepmother, or mother has say left the baby, or orphan baby. These are the babies where this issue develops, and therefore precaution should be taken that smaller babies should get breast milk, or a breast milk from the donor's milk in the form of milk from the breast milk bank. Now breastfeeding and next pregnancy. Now if the mother has conceived, normally what happens, if proper say breastfeeding is being given, there is a lot amount of spacing, and so there is a natural method of say the preventing pregnancy. But if in case there is a pregnancy which has developed, in that case what is to be done? The mother is all the while anxious whether should I give or not. It is being found out that if mother's nutrition is adequate, then breastfeeding doesn't have any negative impact either on the suckling baby or nor on the pregnant mother. So in case she desires, she can continue. Then working mothers, the mothers who are working, they have got lot of confusion, they have got lot of anxiety that after the baby, after the delivery, what I should do. Should I continue breastfeeding? Should I start breastfeeding, or should I start right from beginning the top feeding? But she has to be given a proper counseling, the important advantages of the breastfeeding, and she should be told that the breastfeeding is the best option. You have got, the government has given you a 6 months leave, so that maternity leave is naturally a great boon for the mother as well as the baby, and that should be optimized more often after the delivery than before the delivery. That is number one. Number two is optimize the timing of breastfeeding. Even if now mother joins after say 4 or 6 months of maternity leave, she should optimize in such a way that before going to for a working or a office, she should feed the baby. She should express some amount of milk and keep it in the refrigerator, so that the caretaker can feed the baby in between, and then as soon as she comes back, she can again feed the baby. This is the way she can optimize the breastfeeding timing and the working hours. And in certain offices where creche facilities are available, there she can take the baby itself, particularly for working mothers. In the creche she can keep the baby, and she can intermittently feed the baby during the office hours as well. No office seniors can prevent her from feeding the baby. So these are the various avenues or methods wherein the working mothers can be helped to feed the baby. Now infections in the mothers and whether to give the feeding or not. There are 3 types of problems. One is first common viral infections, hepatitis A and syphilis. These are the conditions where if mother, even if she has got these infections, do not carry much of risk following the breastfeeding. So there is no harm, she can continue. If the baby has to develop an infection, she has already developed during pregnancy, or even if certain infections like say a simple common cold and cough is there, she can definitely feed the baby, because whatever the immunity she develops, that immune factors are transferred across the breast milk to the baby, and therefore that does not give any extra burden of infection or risk of infection to the baby. So no harm in these conditions. Then there are certain conditions where precaution is to be taken. Say for example tuberculosis and hepatitis B. In case of tuberculosis, she must take the anti-TB drugs first of all. She must use the mask while feeding the baby, and baby can be given a chemoprophylaxis for the first 6 months period following delivery, so that the risk of contracting tuberculosis can be prevented. Then coming to the hepatitis B, if mother has got hepatitis B, HBsAg positive, then in that case baby should be immunized immediately after birth with hepatitis B vaccine, as well as given a passive vaccination in the form of hepatitis B hyperimmunoglobulin. Now, so both the things can be given immediately or within 12 hours after delivery on 2 thighs. So the 2 different injections on 2 different thighs has to be given, and that will take care of the risk of developing hepatitis B. Now, such babies, whether the subsequent doses has to be given at 4 weeks instead of the 6 weeks period. We can give second at 4 weeks, and then third at say 10 to 12 weeks, and fourth at 9 months period. And at the time of 9 months, she can find out the one can check the baby's immune status by examining the immunoglobulin levels, hepatitis B specific immunoglobulin levels in the blood, and therefore one can say that the baby is completely immune, not to worry about. And breastfeeding does not carry any extra risk, because this is a infection which is not transferred orally, but it is transferred via parenteral methods or via the vertical transmission from the mother to the baby through the placenta. So, baby has to be given, and the most commonly what happens, this infection is transferred, if at all, from the mother to the baby during the time of delivery, not before delivery. So, during whole of pregnancy the infection is not transferred, but during the time of delivery itself, when there is a risk of mixing of mother's blood with the baby's blood, that is the time only when the infection occurs, and therefore this can be prevented by early immunization, both hepatitis B as well as the hyperimmunoglobulin to be given to the babies immediately after delivery. So, this is precautionary measures to be taken. Then there are certain harmful infections like HIV infections and herpes infection. Coming to the HIV infection, if mother is positive for HIV, she of course must be on a antiretroviral therapy and then she has to take the option either to feed the baby or not to feed the baby. If baby is coming from a low socioeconomic status and there is a risk of developing say protein energy malnutrition out of say not feeding the baby with the breast milk, then in that case breastfeeding can be given. On the contrary, this baby also should be given nevirapine for a period of minimum 6 weeks after delivery. As far as the herpes infection is concerned, during the time of particular herpes, active herpes, say vesicles are present around the nipple or around the breast tissue, during that period the milk has to be expressed, pasteurized, and then only to be given rather than given directly. So, these are the harmful conditions which has to be done. Now, mother is a thyrotoxic mother and she is on anti-thyroid drugs. What should be done? Most of the anti-thyroid drugs do not cross in large amount along with the through the breast milk. Very small amount is carried, but if at all one has to be taken extra precaution, then mother should take the tablet, because it is only once a day or twice a day at the most. In that case, she should feed the baby first and then take the morning dose of anti-thyroid drugs, so that the baby do not develop any complication of anti-thyroid drugs. So, these are the ways one can achieve the negotiate the problems which are. So, we have discussed so far about the conditions in the mother, conditions in the baby which interfere with the adequate or proper lactation and lead sometimes to the failure of lactation if they are not being properly addressed. Now, how to achieve successful lactation? A simple method, the normal method. First and the foremost, the preparation of the mother should start from the antenatal period, not after the delivery, and physical, mental and dietary intake has to be advised, so that the mother is now ready, prepared with that, yes, I am mother, I will definitely take the challenge of breastfeeding and I shall be successful in all throughout the period. So, that has to be prepared. So, the physical status, the examination of the breast, her weight and all growth profile has to be found out, her mental status has to be examined, and dietary intake, adequate amount of calories and proteins she has to take. Then timing and frequency. In the neonatal period and late neonatal period, and infancy period, the frequency go on decreasing. Earlier in the neonatal period, you have to give either every 1 hourly or every 1 to 2 hourly. But late neonatal period, you can give every 3 hourly. Then infancy period, every 4 to 6 hourly. Demand versus scheduled feeding. Now, babies who are full-term babies, who are healthy babies, who are vigorous babies, there the demand feeding is the best option, because that matches with the baby's requirement and the readiness of the mother. Scheduled feeding is required in babies who are sick, babies who are premature, that they don't cry even if they are hungry. In that case, the scheduled feeding every 1 hourly or every 2 hourly, depending upon the size of the baby. Now, adoption of feeding techniques. What position has to be adopted? Any position which is comfortable to the mother, that should be advised. Not that only one specific position should be only used, but she can use any posture wherein she is comfortable. Either sitting posture, reclining posture, or a lying down posture, football hold posture, or whatever is there. Latching is very important task. The baby should be so applied that the large amount of the areola is inside the baby's cavity, oral cavity, and nose does not stuck up with the breast tissue, and the lower lip and the chin of the baby touches the breast tissue. So, this is how the posture has to be adopted, and the latching should be adequate enough. Then milk transfer. When the baby is taking the milk, one has to see whether there is a suck, whether there is a pause and suck response. So, suck, pause, suck response is there or not. So, baby intermittently should suck, pause for few seconds, then again suck. So, this type of response will tell that yes, the baby is taking the milk and milk is also coming out. So, this type of phenomena has to be watched quite frequently. Then few words about the human breast milk bank. Sometimes one can have a short note on this particular topic. So, what is this human breast milk bank? In olden days, we were seeing that wet nursing, that means the nursing the baby, that means feeding the baby by another lactating mother, that is called as a wet nursing, because the mother is either because of her condition, if she is serious because of, say, for example, she has got eclampsia or she is under treatment or some other problem is there. In that case, wet nursing was in practice. But what was the problem was that it was non-scientific. That means we did not know what is the status of the mother. She was not examined whether she is carrier of certain disease or not, and therefore, and it was not matching with the requirement of the baby. So, therefore, that nursing phenomena is nowadays scientifically is being discarded. And in view of this, the second method, that is modern human milk banking, is in its infancy in India, but it is now prospering all throughout India over the years. Now, lack of awareness, leadership deficit, and infrastructural and maintenance costs, and fewer neonatal setups are some of the reasons for the same. Why such? We have got several blood banks, but the very few the milk banks, the breast milk banks, and this is simply because there is a lack of awareness. What is that? The need of the breast milk is there. Then leadership deficit and infrastructural and maintenance costs, and because this milk has to be given free of cost, it has not to be charged at all. And fewer neonatal setups are some of the reasons for the same. Now, the first milk bank in Asia, in whole of Asia, under the name of Sneha, was founded by Dr. Armida Fernandez, and that was started in Dharavi, that is in Sion Hospital, Mumbai. So, that was the first breast milk bank which was started in India, in whole of Asia. Now, what is meant by a human milk bank is a service established for donated human milk. And the processes of these particular banks are fourfold. One is collection, second one has to screen that milk for the presence of any infection. Then, so processing is important, and then it has to be stored at a minus temperature, and then we have to, while giving it, it has to be thawed, and after thawing, one can distribute the milk. So, these are the 4 steps, minimum 4 steps involved in giving this or carrying out these human milk banks. Common barriers we have already discussed: inadequate knowledge, maternal age, place of delivery. Mothers, donating mothers should also be ready, and receiving mothers also should be ready for. Then social customs, maternal education level, these are interfering factors. Parity, modernization, psychological factors, maternal working status, gestational age, health education, type of delivery, and interpersonal and socio-economic status. So, these are various factors which are certain barriers, but if these are many of them, more than 80% of them, they are negotiable, and one can definitely establish the modern human milk bank. So these are very important factors: inadequate knowledge, social customs, modernization, and interpersonal relations. Now recipient babies, these are the babies, how the milk is given. Suppose it is a very premature baby and one has to prevent the mother is not there, and mother has delivered some at a very distant place, and this baby is being given the milk from the donor's milk, from the milk donor milk banks. Another baby who is thriving well and developing well with this particular type of this thing, even though the baby is on a oxygen support with the help of a transnasal catheters or the transnasal oxygen support. So what we need is a healthy volunteers, lactating mothers and healthy babies. That is the first requirement. Preparedness has to be there, motivation has to be there, and myths and taboos has to be dispelled. If these myths and taboos are there, then this cannot be succeeded. Screening of donor mothers for infection is very important. Motivating manpower. This is one of the slide from the net which is taken. This is from South India. Relatives of donor mother, recipient baby's mother, social workers, nursing staff, myths, doubts, taboos to be removed, advantage of breast milk to be doctrined in the minds of prospective and lactating mothers, and disadvantages of formula feeds. All these are the factors which are to be explained to both the donating mothers as well as to the recipient mothers. This is how the testing for common infections is to be done, and then storage. The infections to be screened for syphilis, staphylococcus, viruses, particularly HIV, STLV, then hepatitis B, hepatitis C, and in case of premature babies, even the CMV virus. So that is also to be screened. So milk collected from screened donors, pasteurized, stored, frozen, thawed, and then pasteurized again and exposed to light, aliquoted and instilled into the feeding apparatus. So these are the various steps involved in the human milk banking system. Screening to be done, that is already being mentioned, and these are the babies who are thriving well with the tube feeding. Now one short note on infant milk substitute. It is TUT, T-U-T, sorry, this is spelling mistake. So what is called as IMS Act. So Government of India way back in 1992 and amended in 2003 Act pertaining to the Infant Milk Substitute Act, right? So it is based on International Code of Marketing Breastfeeding Substitute. So what happens? One has to regulate the production, supply and distribution of the breast milk substitute, feeding bottles and baby food. So not only the top milk, powder milk or any other milk, then the instruments which are used like say feeding bottles or the nipples or the baby foods, all these substitutes, they are to be not advertised at all. They are banned, because this is a Parliament Act. Any company doing this, they will have to face the criminal charges. All advertisements and promotion of breast milk substitute is being banned. Gifts and free samples of milk substitute to mothers and healthcare providers is also banned. So that should not be done at all, that should not be accepted at all, because both are likely to be penalized, the company which gives and the person who receives that. The picture of mother or baby or cartoons on labels of items is also to be banned. So any mother or baby being shown on that particular cartoon or advertisement is also banned. And sponsorship, donation and payment of commission for promoting sales is also to be banned. Anybody taking commission, anybody donating it, anybody sponsoring any act, that all has to be banned by this phenomenon. Now coming to certain myths regarding breastfeeding in India. So we see that in society there are various myths regarding the breastfeeding, particularly in all developing countries including India, and therefore that interferes with the success of lactation. And let us see what are those myths. Now first thing is the colostrum. First milk should not be given to the baby. This is what is the myth in the minds of the people. But what is important is that colostrum helps and protect the child from various diseases, and it is rich in immunoglobulins, vitamin K and vitamin A and maternal antibodies. So therefore, this is a false perception. Then babies need water in addition to breast milk. This is again another custom which is being followed, particularly jaggery water or honey water or something like that. But this is again a misconception. The breast milk is 90% water. So breastfeed babies do not require additional water. That is most important. In fact, water reduces the baby's hunger and decreases the milk production in the mother. So also it can be a source of infection. So it is better not to give. Only in very warm weather, particularly in Nagpur in the month of May or June, in like that, occasionally if baby is too thirsty or the urine volume is too less and baby's weight is going down, what is called as dehydration fever, in that case the ORS has to be given rather than just a plain water. Babies should be given honey or sugar water soon after birth. These substances are actually traditionally given, but it does more harm than any good. Moreover, it increases risk of infection and NEC in the babies. What happens in stoppered honey bottles, there is a risk of developing botulism. These botulism spores, they grow very well and that can lead to a very serious infection in the baby. So such practices should be strongly condemned. Excessive crying in a newborn is always due to inadequate milk. This is a concept. So all the while we say that mother should feed the baby because baby is crying, but it is not all the while so, because the crying may be because of several reasons. It is a common practice to switch to formula feed as inadequate milk is taken as the only reason behind excessive crying. However, there can be other reasons like fever, abdominal pain, ear infection, or simply wanting to be picked up or a wet nappies behind a crying newborn. So that should be taken care of. Mother should not breastfeed if she is suffering from infection. Breast milk itself is unlikely to pass infection and therefore it should be continued. Nipples should be washed each time before feeding the baby. This is a conception, but this is a misconception. Washing the nipples make the area dry by removing all the naturally protective oils, and therefore it leads to soreness and cracks in the nipples, and therefore it should not be done every time because it becomes painful. No drug is safe to take while breastfeeding. There are only few medications that are contraindicated during breastfeeding, like anti-cancer drugs or something like that. So many common medicines can be given during breastfeeding and nothing to worry about. Amount of milk secretion in lactating mother depends on the size of the breast. This is again a very big misconception. What happens, we have already seen that milk production depends on demand of the milk from the baby and not on the size of the breast. Milk secretion depends upon number of secretory glands in the breast, which is same in all the breasts, because size of the breast is decided by the fat tissue rather than by the secreting areola. So size is determined by fatty and connective tissues, which is irrelevant to milk production, and therefore breastfeeding does not depend on the size of the breast. Breastfeeding mother should not eat certain food items and avoid others. This is another misconception, very commonly seen. So mother should eat a well-balanced diet containing cereals, pulses, vegetables, fruits and milk. So there is no specific diet that she should only take. A woman who becomes pregnant must stop breastfeeding. This is another misconception. Breastfeeding does not have any effect on the pregnancy, nor pregnancy have any effect on the quality of the breast milk. So she can continue as far as possible, as far as her nutrition, mother's nutrition is adequate. It is dangerous to breastfeed during menses. This is another misconception. It is completely safe to breastfeed even during menstruation. Jaundice in the newborn is due to certain dietary items. This is another misconception. Jaundice in newborn is not related to mother's diet or breastfeeding. It is very rare to have a relationship between a breastfeeding and a jaundice, what is called as breast milk jaundice. This is very rare. No need to stop breastfeeding during neonatal jaundice. On the contrary, jaundice is because of infrequent feeding. Rather, frequent feeding gives rise to more of laxative phenomena, and that becomes this thing. Now, baby-friendly hospital initiative. This can be one short note. Now, what are the recommendations for hospital? These are 4. One should have a written breastfeeding policy. routinely communicated to all healthcare staff to promote and support breastfeeding. Second, hospital staff should get trained in breastfeeding promotion skills. And third is rooming in practices be adopted, and to foster establishment of breastfeeding support groups and follow-up services has to be there. So there should be some social organization which can help. Now, related to the mother, antenatal and postnatal period benefits of breastfeeding has to be doctrined in the minds of the mother, prospective mothers, to initiate breastfeeding within 30 to 60 minutes of delivery, and demonstration of how to maintain lactation, that also should be told to her and demonstrated, and to encourage on-demand feeding, particularly active and vigorous babies. Now, pertaining to baby, exclusive breastfeeding, no food or drink other than breast milk, that is what is required, and artificial feeds and pacifiers as far as concerned, a big no. So, these are the 10 items in the baby friendly hospital initiative which is being adopted all over the world, including the UNICEF and WHO. Now, in summary, prospective mothers be prepared for breastfeeding right from ANC period to start breast crawl and KMC, that means kangaroo mother care, and breastfeed within half an hour in a normally vaginal delivered baby. Ensure babies and mother's health is in normal condition before we all the while insist for breastfeeding. Both the conditions has to be proper. Ensure proper general condition of the mother and breast, and as well as latching. Physical, mental and emotional status of the mother is to be ensured as normal. Demand feeding, and in premature babies, schedule feeding has to be adopted. Frequent feeding for first week and later on every 2 to 3 hourly feed has to be given. Posture of the mother comfortable for feeding be utilized. Whatever is comfortable for the mother is to be utilized. Complete emptying of both breasts is ensured, and no pre-lactal feed, no bottle feeding or any traditional medicines to be given. Baby friendly hospital initiative be adopted by all the hospitals also. Mother's milk is the best feeding option for low birth weight infants as well, and therefore don't consider that low birth weight baby will not suck. She can definitely suck. Even non-nutritive sucking can help promote the lactation. Enteral feeding should be initiated as early as clinically appropriate, and minimal enteral nutrition should be provided if volumes cannot be advanced. Low birth weight neonates can be successfully fed with express breast milk via nasogastric tubes or variety of other traditionally and culturally accepted devices like boneless and other things. Non-nutritive sucking and kangaroo mother care are useful adjuncts to maintain and enhance breastfeeding and nutrition. All LBW infants who are exclusively breastfed should also receive supplementation of vitamin D because it is deficient in mother's milk, some calcium in preterm babies and low birth weight babies, and phosphorus. Iron supplementation are also required 2 to 3 milligram per kg per day at 6 to 8 weeks of age, not immediately after delivery, and as early as 2 weeks in babies who are below 1500 grams, and that is effective in preventing anemia of prematurity. All infants be checked for weight, head circumference and length in newborn period. So, monitoring of the babies, whether the baby is really developing well or not, that is important. So, take home message is all LBW infants who are exclusively breastfed should receive supplements. Iron supplementation should be given as 6 to 8 weeks, and all LBW infants should be checked for weight category. So, the last slide is ancestors knew the importance of breast. Freshers must know that it is the best. Breastfeeding develops body and soul both. Teachings must propagate its role. Breastfeeding strengthens baby and nation. Why not optimize this nature's creation? Before top feeding alters the biology and you convey your apology, let us percolate, emphasize and comply the breastfeeding psychology. So this is all about the breastfeeding, and thanks for the patient hearing. Thank you very much.